guys, it's Khaki. Today I want to talk to you about common patient misconceptions about bariatric surgery. These are things that I thought wrongly before I actually went through the process, and also things that I've had my patients express to me when they are going through that preoperative approval process. So let's talk about it. One common misconception, and one that I shared, was that you won't be able to eat your favorite foods anymore. I have found that very much to not be true, with the caveat that if your favorite food is ice cream or candy bars or simple carbohydrates, there is a chance you won't be able to eat that without really wishing you hadn't. I have talked extensively about how I dump if I eat simple carbohydrates and simple sugars, but anything else I've been able to fit into my plan. I do make choices that are more healthy, but anything I really enjoy, I found a way to still have it. Another misconception that I hear a lot of people say is, well, I can eat whatever I want because I can't fit much in my stomach anymore. I think that that is a false impression and is a path to regain. If you think that you can eat anything because you have restriction, that's a recipe for disaster. I think that we, as bariatric surgery patients, need to focus more on the foods that are more aligned with a healthy journey, like proteins, healthy carbohydrates, non starchy vegetables, some fruits. Thinking, well, I can eat uh, French fries forever. I just won't be able to eat many of them. I can eat whatever I want because not be able to eat much anyway. It's not that you can't have certain things, but counting on that restriction to carry you through weight loss and through maintenance is probably not a good thing. Another misconception is that your hunger goes away forever. Gosh, I wish that was true. This was something I really thought before I had surgery and in those first few months. It was so wonderful not to constantly feel hungry. At about a year to 14 months, my hunger returned. And that is when establishing patterns, routines, and new healthy habits really comes in. Going back to one of the misconceptions earlier about I can eat whatever I want to because I can't fit much in my stomach, when your capacity grows and that hunger comes back, it's probably not going to be a good thing if you feel that way. Hunger does come back, and it just, for most people, it does. Some people, it never leaves. I was blessed to, like I said, not be hungry for about a year, but it has come back, and I've had to learn how to deal with it. Another misconception that I had was you can prevent hair loss. You just have to take the right vitamins, make sure you get protein, make sure you get your supplements, and you're not going to have hair loss. Well, I can tell you for me and for most patients that I interact with, that is not true. I got the recommended amount of protein throughout my journey, except for that first couple of weeks. I don't think anybody is able to get it in then. I took my supplements faithfully and I still had hair loss. It just happens. I think it's inevitable. I did a video on hair loss after bariatric surgery if you want to search for that. It does come back. And for me, I felt so good with my healthier body and my healthier diet that the hair loss didn't bother me like I thought it would. So, but there's not a whole lot you can do to prevent it. Another misconception is you're not going to be able to eat out. For me, if you follow my journey, you see I eat out multiple times a week. I just make choices that are aligned with where I need to be. But you will, if you enjoy it, you will be able to eat out. Don't worry. A big misconception that I had and that I hear a lot of my patients express is if you tell people you're having bariatric surgery, they're going to judge you or they're going to try to talk you out of it or discourage you. For me, that has not been true. I have not had a single person to my face try to discourage me. I have had everyone that I have told, and as I have also discussed in previous videos, I am very open. If somebody asks me, "What have you done to lose weight?" I tell them because it's nothing for me to be ashamed of. I think that taking the shame and the hidden in the darkness aspect out of bariatric surgery is something that I feel strongly about. So I have told anybody who I've interacted with, and I have not had anybody try to discourage me. I have had people express concern, especially in the early stages and when I was pre op, just saying, I hope that you understand the choice that you're making, and I have assured them that I did. But as far as feeling judged or feeling like people were discouraging me, I have not experienced that at all. Another misconception is that what you will be able to eat is going to be the same as your friends that have had bariatric surgery, the people that you see on YouTube like me, or on TikTok or any other social media. Everybody is different. Every surgeon does things a little bit differently. Everybody's anatomy is different. We are all individuals. What I can eat is probably not what you can eat. What you can eat, vice versa, is going to be different than what I tolerate. You have to find what works for you. Fruit. I thought that I was never going to be able to eat fruit again. At about 4 to 5 months, I started introducing things like berries. At about a year, I started adding in some higher glycemic index fruits like bananas, oranges. I do eat them mindfully and look at my sugar when I eat them to make sure I don't have dumping. But I love fruit. I probably enjoy fruit more now than I did before surgery. Probably because I don't eat all the crap that I used to. So fruit is a sweet treat for me. And I can eat it. I hope that those of you who are in the bariatric surgery journey will find that true as well. Last, biggest misconception that I had and that I think most people have is what you eat will stay the same after your journey, after your surgery, to a year, 2 years, 3 years post op. As we've talked about before, your pouch heals, the natural elasticity comes back, your volume that you could, the size of your sleeve or your pouch does not increase, but the elasticity returns back to normal. It's like when you have a bruise and your pouch is bruised, your sleeve is bruised, and it's firm. After the healing period, it's not as firm anymore, and it can expand to accommodate more food. You still have restriction. I can tell you at 18 months, I still have restriction, but I can eat more, and that's not a bad thing. I think that if we have the misconception that when we are 3 months post-op and we can only eat a half a cup total volume, if we think that's the way it's going to be forever, as your capacity increases, you're going to think something is wrong and possibly panic. So I think that if we understand that from the beginning and overcome that misconception, things will be a lot smoother for us and we won't have that fear. I would love to hear, what misconceptions did you have? For those of you in the post-op period, what did you erroneously believe going into this journey? What have you heard people say that is just not true? What are the misconceptions you've run into? I would love to hear feedback in the comments below. I would love to hear video suggestions. This is a video suggestion from somebody who left it in the comments, so I hope you're watching. I hope everybody has a great week. I do have an 18-month follow-up with my bariatric surgeon this week, and I also have my 3-month follow-up with my plastic surgeon. So I may make a quick little video updating you on that. So be on the lookout for it. Have a great week, everybody. We'll see you next Wednesday. Bye.